Good afternoon. I am Dr. Sai Meghana, Junior Resident from Sarojini Devi Eye Hospital, Hyderabad. The topic of my presentation is Tumor in the Blink of an Eye, a retrospective study of meibomian gland carcinoma. Meibomian gland carcinoma is a rare but highly aggressive eyelid malignancy. It often mimics benign ocular condition leading to diagnostic delays. It exhibits various geographical variation with higher incidence noted in Asian Indian population. It has high recurrence and metastatic potential with diverse histological patterns. Chronic eyelid inflammation, prior UV exposure or irradiation, and genetic predisposition are the known etiological factors. It originates from the meibomian glands located in the tarsal plate of the eyelids. Lobular comedocarcinoma or papillary patterns are the patterns noted. Characteristic feature is the pagetoid spread noted on histopathology. Our study aimed to review biopsy-confirmed cases of meibomian gland carcinoma to highlight its clinical profile and histopathological features. We conducted a 10-year retrospective observational study of biopsy-confirmed cases of meibomian gland carcinoma, analyzing their demographic details, tumor characteristics, and treatment outcomes. Coming to the results of our study, this age distribution graph here highlights that the majority of cases were in the 5th decade of life, with mean age at presentation being around 58.6 years. Out of 131 cases analyzed, 85 were females and 46 were males, showing a female predominance of about 65%. This age distribution graph here depicts the same. All cases were unilateral, with upper eyelid being the most common site, followed by the lower lid involved in 35 cases, and 2 cases involved both the lids. On histopathology, majority showed a lobular pattern, with most of them being well differentiated. Additional findings included involvement of resected margins noted in 14 cases, pagetoid spread seen in 11 cases, and orbital extension in 2, and a distant metastasis in 1 case, which involved metastasis to the lung. On histopathology, here lobular pattern with involvement of resected margins are seen with atypical sebaceous cells and high nuclear cytoplasmic ratio. Here lobular arrangement with pagetoid spread into the overlying epidermis is present. Lobular pattern with areas of central comedonecrosis. Here interspersed between malignant lobules are areas of benign appearing sebaceous glands with preserved architecture. Coming to treatment, wide local excision with 4 mm margins with or without lid reconstruction was done in all cases as a standard procedure. All cases were operated by the same surgeon, with 2 cases being requiring orbital excenteration. In our study, several key characteristics of meibomian gland carcinoma were highlighted. We observed a clear female predominance of nearly 2/3 cases being women, with mean age at presentation being around 58 years, consistent with the global reports that place the peak incidence between 5th and 7th decades of life. The upper eyelid was the most common site, with accounting for over 70% of cases, which is explained by the greater number of meibomian glands in this region. On histopathology, lobular pattern was the most common subtype, although comedocarcinoma, papillary, and mixed variants were also noted. Importantly, we noted pagetoid spread in around 8% of cases, which is clinically significant, as it represents intraepithelial extension, which can be often missed, leading to recurrence if not carefully mapped and excised. Specimens were mostly small, firm gray-white nodules with occasional yellow areas on gross examination. Few larger tumors indicated delayed detection requiring wider excision. A decade-long study with large sample size here revealed clinical patterns. Histopathology helped in guiding us about tumor behavior and prognosis. Limitation was in its retrospective study design and a single-center study, which may limit the generalizability to a wider population. In conclusion, meibomian gland carcinoma is highly aggressive and often misdiagnosed. High risk of pagetoid spread necessitates thorough histopathological evaluation in all cases. Any persistent or recurrent eyelid lesion in an elderly patient should raise the suspicion of meibomian gland carcinoma. Early suspicion and precise diagnosis are the key to improving patient outcomes. The lid may look calm, but within may lie a storm. Meibomian gland carcinoma teaches us the power of timely diagnosis. Thank you.
Dr. Meghana, what was your final prognosis? How much cases, out of what cases you have studied? What was your final prognosis?
The study was mainly to analyze the treatment outcomes.
How many cases you have taken in this study?
131.
131 cases. What was the prognosis?
Only around 14 cases involved involvement of resected margin, sir, and 2 cases required operative. All of the cases were managed with IRID reconstruction.
Thank you.
Did you compare this study with any other study like Pagetoid? It was 8%, no? 8.1. So
Other
did you
studies-
compare with
Yes, sir. In other studies, it was around 15% around.
15%?
Thank you.
Okay, thank you.
Thank you. Thank